Hey everyone, so we're going to finish our notes here now on the lower respiratory tract. We have already covered the upper respiratory tract, which includes the nose, the pharynx, the larynx. So if you did not get those notes down yet, I would go back and do that. Now we are moving down into the lower respiratory system. So the trachea is going to be this tube that goes from your larynx all the way down into your lungs. This is also called the windpipe, and you may have heard of something called a tracheotomy. If someone is choking and something is stuck within the larynx, they can bypass the larynx by putting a straw or tube into the trachea. So they'll go in and at a really sharp angle shove something down in there to at least get that airway open again so that the person can breathe and get some oxygen past that. So the tracheotomy happens by going directly into the trachea. We see that this descends just anterior to the esophagus, which is going to be behind. And the lining of the trachea, just like how the lining of the nasal cavity has that pseudostratified columnar epithelial tissue. So pseudo, once again, being fake, so it looks like the epithelial tissue there is layered, but it's not. It's just that different cells have different layered nuclei. And we have lots of mucus in this as well. So once again, we're doing this to warm and moisten that air that is going into our lungs. And then around the trachea, we have these C-shaped rings with the hyaline cartilage in order to make sure that the tube does not collapse in on top of itself. Then we get into the bronchioles. So you can see the picture over here. We've got the trachea, and then we have the right main bronchus and then the left main bronchus, and then those two split up. So the bronchi, which is the plural bronchial tubes, these are the tubes that branch off of the trachea and then start to divide again into the lungs. So this really looks like a system of roots, how it starts out with the main trunk and then it splits off into the left and right lung. So we see that left and right primary bronchi then go into the secondary bronchi, tertiary bronchi, then the bronchioles, which are the very, very small bronchi, just like how the arterioles were the little baby arteries and the venules were the baby veins. And then we get into the terminal bronchioles. Terminal means end. And then eventually the respiratory and the alveolar ducts, alveolar sacs, and then the alveoli. So we'll talk about all of that, but what you do need to know for the test is that as we go from the bronchi into the alveoli, the amount of cartilage decreases and the amount of smooth muscle increases. This is going to be a huge concept that we're going to see again and again. In the trachea, we want to make sure that we have lots of cartilage in order to keep this open. But as we get into the lungs, we want to make sure that we have more smooth muscle so that we can control those airways a little bit more. So the smooth muscle increases as we get into the bronchioles, and the cartilage decreases as we get into the bronchioles. So once again, looking at everything kind of pulled together, we've got the larynx, which is up here at the top, the trachea, we've got the right and the left bronchi, then we get into the bronchioles, which are going to be farther down in here, and then at the terminal ends we'll see the alveoli, which are like these little grape clusters. So when you see videos of lungs, they often show healthy lung compared to a smoker's lung. When they inflate those lungs, it's very, very spongy, and you guys will be able to feel the lungs when we're dissecting our fetal pigs. It's like it's essentially a sponge. It's got lots of holes in it. It's very airy. And the alveoli, they look a lot like clusters of grapes. So we talked about how increased surface area is really beneficial for the nasal cavity because that allows for more of that air to be filtered, moistened, and warmed up. But as we get into the alveoli, the more surface area we have within the terminal ends of these tracts is going to equate to more blood getting oxygenated. So this is the ultimate site of gas exchange. These alveoli are made up of very, very, very thin tissue, which, as we talked about with epithelial tissue, is a simple squamous, so a single layer of squished cells that are within the alveoli that make up that very thin layer. And if you look over here, one alveoli, or the alveolus, is going to be one of those little circles, one of the little grapes. And then we have the basement membrane that is going to fuse the alveoli and then that capillary bed together. So now we're seeing all of these capillaries being perfused throughout the alveolus so that we can get as much oxygen into the blood as possible and as much carbon dioxide out of the blood as possible. So here we've got a good example of how those capillary beds wrap themselves around the alveoli. Once again, we are going to see with the pulmonary artery. The pulmonary artery has deoxygenated blood, so it's going to have like this bluish, it's not really blue, it's dark red. It's going to have that deoxygenated blood. As that blood then passes through the alveoli, it's going to pick up oxygen and get rid of the carbon dioxide, and then return back to the heart through the pulmonary vein with oxygen, and it's going to be bright red. So in a disease that we'll talk about later on, we see emphysema, which is a respiratory disorder that affects a lot of people that end up smoking. And what ends up happening here, we have lots of surface area, which means more gas exchange within the alveoli. If someone is a smoker, we end up destroying a lot of these alveoli so that instead of having like the grape clusters, it just kind of turns into like just a big all formed sac. So we have less surface area in between this entire cluster right here, which means that there's less gas exchange. So when people have emphysema, they don't get as much oxygen to their muscles, and so they are short of breath. They often have hard times catching their breath just from going up a flight of stairs. And it's not because they have decreased muscle, it's because they are literally not able to get as much oxygen into their blood through their lungs as they once were. So I want you guys to pause the video here. I want you to take this quick quiz. When I see you tomorrow, we're going to go over this quiz. I'm not counting it 4 points, but I am expecting you guys to know this because tomorrow we are going to be working with an activity and I am not going to be reviewing this information again. If you have any questions, feel free to message me on Schoology, but good luck and I hope you have a great day.